Welcome back to Diabtron, where we prioritize your health and well-being. Today, we're delving into a crucial topic for those managing diabetes: Diabetic Ketoacidosis DKA and Hyperosmolar Hyperglycemic State HHNS. These are serious complications that demand our attention and understanding. In this video, we'll explore the definitions, causes, symptoms, and management of DKA and HHNS. Whether you're someone living with diabetes, a caregiver, or just interested in health education, this video is packed with valuable insights. But before we dive in, don't forget to hit that subscribe button, give this video a thumbs up, and ring that notification bell so you never miss our health-focused content. Are you ready to enhance your knowledge and take proactive steps in diabetes management? Let's jump right into the essentials of diabetic ketoacidosis and hyperosmolar hyperglycemic state. Let's get started on the path to informed and empowered health decisions. Diabetes, a chronic metabolic disorder affecting millions worldwide, brings forth various complications that demand careful consideration. Two severe and potentially life-threatening complications, diabetic ketoacidosis DKA and hyperosmolar hyperglycemic state HHNS, underscore the critical importance of managing blood glucose levels in individuals with diabetes. Diabetic ketoacidosis is a medical emergency characterized by a profound insulin deficiency, resulting in hyperglycemia, ketosis, and metabolic acidosis. DKA is most commonly associated with type 1 diabetes, but can also occur in individuals with type 2 diabetes under certain conditions. It is characterized by a triad of hyperglycemia, ketosis, and metabolic acidosis. DKA is often triggered by insulin deficiency, leading to an imbalance in glucose metabolism and the production of ketones. DKA is commonly precipitated by factors such as uncontrolled diabetes, missed insulin doses, infections, trauma, surgery, or other stressors. The absence or insufficient levels of insulin prevent cells from utilizing glucose for energy, prompting the body to break down fats, resulting in ketone production. Symptoms: polyuria, excessive urination; polydipsia, excessive thirst; polyphagia, excessive hunger; abdominal pain; nausea and vomiting; rapid breathing; small breathing. Physical findings: dehydration, altered mental status, hypotension, tachycardia. Insulin deficiency, decreased or absent insulin levels result in impaired glucose uptake by cells. Cells shift to alternative energy sources, such as fatty acids. Ketone production: increased breakdown of fatty acids leads to the production of ketones, acetoacetate, beta-hydroxybutyrate, acetone. Accumulation of ketones in the bloodstream contributes to metabolic acidosis. Acidosis, ketone buildup, results in an acidic environment, causing a decrease in blood pH. Metabolic acidosis impairs cellular function and can lead to life-threatening complications. Diagnosis of DKA is typically based on a combination of clinical presentation and laboratory findings, including hyperglycemia, blood glucose 250 mg/dL, ketonemia, and metabolic acidosis. Treatment and management: fluid replacement. Intravenous fluids are administered to correct dehydration and restore electrolyte balance. Fluid replacement helps improve perfusion and facilitate insulin delivery. Insulin therapy: regular insulin is administered intravenously to suppress ketone production and lower blood glucose levels. Continuous monitoring of blood glucose guides insulin titration. Electrolyte management: electrolyte imbalances, particularly potassium, are corrected to prevent complications like cardiac arrhythmias. Regular monitoring of electrolytes ensures appropriate adjustments in treatment. Understanding and promptly addressing the components of DKA, including insulin deficiency, ketone production, and acidosis, is essential for effective management and prevention of severe complications. Hyperosmolar hyperglycemic state HHNS, also known as hyperosmolar hyperglycemic non-ketotic syndrome HHNS, is a severe complication of diabetes, primarily associated with type 2 diabetes. It is characterized by extreme hyperglycemia, profound dehydration, and increased blood osmolarity. Unlike diabetic ketoacidosis DKA, HHNS is marked by the absence or minimal presence of ketones. Causes and triggers: HHNS is often triggered by factors such as uncontrolled diabetes, infections, inadequate fluid intake, and medications that may exacerbate hyperglycemia. It commonly occurs in older adults with type 2 diabetes. Symptoms: profound thirst, excessive urination, altered mental status, ranging from confusion to coma, seizures in severe cases, visual disturbances, physical findings, dehydration, dry mucous membranes, sunken eyes, hypotension, tachycardia, neurological deficits, e.g., focal neurological signs, pathophysiology, severe hyperglycemia, profound elevation of blood glucose levels, often exceeding 600 mg/dL. Hyperglycemia leads to osmotic diuresis, causing excessive loss of fluids. Dehydration. Osmotic diuresis results in significant water loss. Dehydration contributes to hypovolemia and impaired tissue perfusion. Hyperosmolarity. Elevated blood glucose levels contribute to increased blood osmolarity. Hyperosmolarity leads to neurological symptoms and potential complications. Diagnostic criteria: diagnosis of HHNS is based on clinical presentation, severe hyperglycemia, and evidence of dehydration. Ketosis is typically minimal or absent. Treatment and management: fluid replacement. Intravenous fluids are administered to correct dehydration and improve perfusion. Fluid replacement is crucial for restoring blood volume and improving electrolyte balance. Insulin therapy. Insulin may be administered to enhance glucose uptake by cells and lower blood glucose levels. Unlike DKA, the emphasis is on gradual glucose reduction to prevent cerebral edema. Electrolyte management. Monitoring and correction of electrolyte imbalances, especially potassium, are essential. Close observation and adjustments in treatment to prevent complications. Tailoring interventions based on the distinctive features of DKA and HHNS is essential for optimizing patient outcomes and preventing complications associated with these severe diabetic complications. Prevention strategies: empowering individuals with diabetes through comprehensive education on the early signs and symptoms of both diabetic ketoacidosis DKA and hyperosmolar hyperglycemic state HHNS. Educating patients on the importance of promptly seeking medical attention if they experience symptoms such as excessive thirst, frequent urination, altered mental status, or any unusual physical discomfort. Emphasizing the critical role of insulin in maintaining glycemic control and preventing severe complications. Encouraging strict adherence to prescribed insulin regimens, including appropriate dosages and timing, to mitigate the risk of insulin deficiency. Establishing a routine for regular self-monitoring of blood glucose levels to detect and address fluctuations in a timely manner. Providing guidance on interpreting blood glucose readings and understanding the target ranges set by healthcare professionals. Encouraging consistent and accurate record-keeping of blood glucose levels to facilitate ongoing management and early intervention. And that's a wrap on our deep dive into diabetic ketoacidosis, DKA, and hyperosmolar hyperglycemic state, HHNS. If you found this information valuable, don't forget to give us a thumbs up, subscribe, and hit that notification bell to stay updated on all things health-related. Your support means the world to us. Share your thoughts and questions in the comments below. We love hearing from our community and addressing your concerns. Remember, knowledge is power, especially when it comes to managing diabetes. Thanks for tuning in to Diabtron, your trusted source for health insights. Until next time, stay informed, stay healthy!